My name is Peter Derman. I'm a minimally invasive spine surgeon. Patients often ask me how they can avoid having back issues, or certainly avoid having them get worse if they already have a history of some intermittent back problems. And there's a couple of things that are really important. The evidence shows that a couple things are really bad for your spine. So one, smoking. So a lot of people know that smoking's bad for your lungs, bad for your heart, bad for your body, but it's less known fact that smoking is really actually bad for your spine as well. It's very damaging to the discs. It inhibits the blood flow to the discs and your general healing potential. So it's not easy to quit smoking, but if you need any additional oomph to get it done, I think doing it for your spine health is another bit of a motivator. And then maintaining a healthy weight is important too, because we're just talking about a mechanical system. So the more weight that's pushing down on these structures, on these discs and these joints, the more wear and tear they're going to have. And so it can be hard, especially if you're in pain, to exercise. But the more you can do, even low impact things, walking and things like that, are beneficial. And honestly, diet is the biggest component of it. So maintaining a healthy diet is probably 90% of the battle. And it's not easy to do, but your back will definitely thank you for it. And then as far as exercises go, in order to kind of prevent back problems, core strengthening is really the key. A lot of people, when I say core, they think abs, they think crunches. Those things aren't necessarily good for you, especially crunches. Because if you think about it, you're just going crunch, crunch, crunch on the discs the whole time. And so things like planks, side planks, those kind of things are better for strengthening your core than crunches themselves. And it's also important not just to focus on the abs, but also the flanks and the back. And so frequently it can be beneficial for patients who are having issues with back pain to visit with a physical therapist. Even my very fit, active patients, not necessarily because they need physical therapy indefinitely, but it can be helpful for them to get evaluated and then just learn a cohort of exercises that they can do on a preventative basis.